welcome to another fun episode of Thrive Live. Today we are going to get into melasma, which is very exciting because this is a condition that I see a lot in my practice, and it is definitely one of the more frustrating conditions for patients because it can take so long. And let's understand why that is and why it takes so long to get down into it. So melasma is more than just a simple quick fix, period. What is it? Melasma is that hyperpigmentation arising from super functional melanocytes. So the cells in the skins that are releasing the melanin, which is the pigmentation in the skin, and they're depositing an excessive amount of this melanin into the top two layers of the skin, so the epidermis and the dermis. We usually see this in reproductive years, mostly women, but men can actually get it as well. We've seen it in hormonal balances in the men with that low testosterone, more so, but anytime we will actually see it in men, which I actually find interesting, even though I've never seen a man in my practice with melasma, is that we actually got cases of it. So what are some of the biggest risk factors? Why would you get melasma in the first place? So first off, we always got genetics. So there is a genetic association with melasma. And then you combine that with exposure to sunlight. So UV radiation specifically, certain skin phototypes are going to be more sensitive to developing the melasma. And of course, hormonal factors. So usually we think of melasma as the hormonal condition, very hormonal driven. It's usually more than hormones in itself. But from the hormone side, we'll see that darkening happening in pregnancy, which is where we dub it the chloasma, hormonal-based therapies, and most often in my practice, I'm seeing it with the oral contraceptives. So the birth controls, I've seen it with even the Paragard IUD, just that tiny bit of progestin, I've seen that trigger it. So not everyone's gonna get melasma from birth control, but I've actually seen that as much more common in my practice than actual pregnancy itself. Of course, what you put in your skin is going to affect your skin. So cosmetics and certain medications, more specifically your photosensitizing drugs and your anticonvulsants, and zinc deficiency. Zinc is a huge nutrient for the skin. It repairs our skin. Zinc is always going to be in balance with copper in the body. I think one of the reasons, common reasons why the Paragard IUD I've seen as a trigger is not only adding that progestin into the system, but it's also depleting your zinc in the body. So then we got two triggers for the Paragard IUD. And I love the IUDs for women for a contraceptive standpoint. The Paragard doesn't have the progestin. My brain is still working with my parents from this weekend. The Mirena is the one that has that little bit of progestin. So we kind of get this perfect concoction between genetics, then we have hormones, we get chronic inflammation. I'll get more into detail in terms of what happens with this inflammatory effect with the melanocytes. And then usually a lot of UV light, but again, certain skin phenotypes are going to be more specific to the UV radiation versus others. So let's talk more in terms of the anatomy and what actually happens in those skin layers. So what we see with the melasma is that there's a penetration of the melanocytes, so the cells that are releasing that melanin and that skin pigmentation, penetrating into the dermis. So it's penetrating a little bit deeper into the skin. And this is part of the reason why treating melasma can be so difficult, especially if you're just focusing on the exterior melasma in terms of peels or topical treatments, because those are trying to kind of burn off a layer and get deeper into there. But with more prolonged cases of melasma, we're seeing that those melanocytes actually are getting deposited into the basement layer of the skin. And it's a big percentage. So 83 to 96% of melasma cases show disruption of that basement membrane in their lesions. And this is why it's so hard, because it's like an internal to the skin issue. And so specifically what we see is that what happens there is that we get an increased level of matrix metalloproteins 2 and 9. So, and these are degrading the collagen in the skin. And that's also going to help facilitate movement of the melanocytes deeper into that dermis. So you get destruction of the collagen, and then that allows the melanocytes to go deeper. Now throw in inflammation. So let's talk about the inflammatory side to melasma. So about 70% of melasma lesions, when biopsied, show a mild lymphocytic infiltrate. So meaning we're actually seeing the lymphocytes infiltrating the cells. So we're seeing this inflammatory infiltration into the dermis. And it's shown as a significant, increase. It's not just a little bit, it's a significant increase. And we're seeing all of the immune cells there, CD4, T cells, CD68, macrophages, mast cells. So we're seeing this overall big spike in very localized inflammatory cytokines. And that in itself is creating its own localized pro-inflammatory effect. It's kind of feeding the snowball forward. And you could, and that's specifically in the melasma lesion versus comparing the normal skin that's just on another part of the body, in the unaffected skin. And so this chronic inflammation with that degradation of the collagen, which is the strength of the skin, is what's allowing those melanocytes to go deeper. And this is a huge reason for why melasma is so prolonged in the treatment and so difficult to treat, because you can't just treat it topically. Let's see, I had a whole bunch of other notes here, and hold on. Another aspect that I found really interesting in the anatomy of melasma is that the macrophages, so for those of you who remember that or don't remember, that is the part, they're like the trash cans of the immune system. So they're going through and kind of sampling tissue and then taking it back to the kind of to our immune system, and or there also can be increasing localized inflammation. So they're sampling this tissue and then they're releasing melanin. So basically they the macrophages go in, they sample the melasma tissue, they ingest that melanin, and then they can actually release it and redeposit it back into the dermis. So they are kind of recirculating extra skin pigmentation for the melasma itself. Now let's talk about the blood flow. So not only in chronic UV exposure, sun exposure, we see increased blood flow to the skin, hypervascularization. We also see the melasma lesions have the same effect. So we have increased number, size, and density of blood cells to the melasma lesions itself in comparison to normal skin. So that in itself is going to be bringing in more redness. It's going to be, anytime you have that hypervascular look, you're going to get changes in the skin. When we also look at chronic UV exposure, we know that damage to the skin drops the production of fatty acids and triglycerides on the skin, which are really important because those fats are really important for maintaining the skin's barrier function. So fats are important for the gut, for that gut lining. Fats are very important for your skin. And that's kind of one aspect of, we're showering once a day. We tend to use soaps that are very, just pulling off all of our good fats on the skin. And so that's, fish oil and omegas, we'll get into that, but those are the food for your skin, is this fat. The skin needs that fat to heal. And so we will see with this chronic UV exposure that the skin gets that dropping in the fats. And then we also have seen, this is kind of more presumptive right now, but we're starting to see suggestion towards that the melasma lesions themselves are down regulating several of the genes linked to lipid metabolism. So if our body's if the skin is using lipids to heal, then the melasma lesions itself are going to have a reduced healing capacity because they're changing the genes that help the lipids heal. Is interesting because similar thing with dementia, where we're seeing changes, you're at increased risk of genetic dementia if you don't have the gene that helps shuttle fat to the brain. Our body uses fat to heal all over the place. And so this connection with fat is very important. So you can see how the dynamic interplay between localized chronic inflammation, UV damage, genetics, all are making a big reason why melasma is not a quick fix, and it's way more kind of than just hormones, and it takes such a long time to heal. So, but let's get into it, and let's start talking about kind of the top 8 pillars that I've clinically seen where we really need to address and focus on melasma to get a result. So let's first talk about the base that we all know. It's driven with estrogen, progesterone. I've literally seen high estrogen, low estrogen cases, high progesterone, low progesterone cases. So it really comes down to the balance of estrogen and progesterone. And there are certain times in our cycle when it's supposed to be high, and other times where it's kind of supposed to be low. And it's all about the overall balance of that estrogen to progesterone. And so there's a lot of factors that are going to be affecting this balance. The health of the ovaries, the thyroid hormones in itself are going to affect ovarian functioning and release of estrogen and progesterone. And we also know that thyroid is itself one of the big triggers for melasma, where there's thyroid disease, thyroid dysregulation, autoimmunity association. The thyroid hormones play an integral role in governing the sex hormone balance. So not just that estrogen progesterone balance, where the thyroid is governing menstrual cycle regulation, it's governing the metabolic function of every cell in the body. So this is going to affect how your estrogen is going to be moving through the liver, how your progesterone is going to be rising in your menstrual cycle. So, and interestingly, it's 2 sides of the coin. You can't just focus on thyroid. The estrogen and progesterone also govern thyroid. So this is where it cracks me up sometimes, where we're all just focused on thyroid, but really it's the whole endocrine picture, because you can't just extract one organ, one hormone out of the whole endocrine piece. They're all balancing dynamically together. Gut is a huge area for melasma, probably the number 1, hands down, place to start for melasma. Why? Is because the flora in the gut will determine a lot of how your liver is functioning, and the liver is going to be a big place where you clear a lot of estrogen out, and also what we dub the estrobolome. So if you have, certain bacteria in your gut are going to be either recirculating your estrogens, or you're going to be allowing to poop them out. We want to try and clear them out of your body. We want to move them. We want you to poop them out. And so fixing the gut flora becomes huge. And unfortunately, we see a lot of gut issues in patients. The restricted gut flora, there's gut's a huge inflammatory source. Melasma is a skin condition that has a huge chronic inflammatory association to it. And you don't necessarily have to be having the IBS, the diarrhea, the Crohn's disease to be needing to go in and fix the gut. It could just be simple as starting with a soil-based probiotic, which we know expands that gut bacteria. And the soil-based probiotics also start to adjust the ecology, because then anytime you go in and treat the gut, we're talking, how is explained, is equivalent to farming. You can't go in and expect to grow a nice, healthy, organic zucchini if the soil is sick, if it's not getting enough nutrients, it's not getting enough water. So because the gut is so dynamic, I like those soil-based probiotics a lot, because they're not just doing flora, they're also helping to improve the ecology. And we're also seeing some research now that the soil-based probiotics can improve liver function and liver disease, which is pretty remarkable. So the gut, hands down, I would say, is the number 1 place to start with melasma from what I've seen clinically, because we won't clear the melasma from the inside until that gut is fixed because of that estrobolome association. And also because the gut can be a seat of chronic inflammation that drives the inflammation of the dermis and the epidermis and the whole melanocyte. So gut is huge. Start there. Adrenals. I like to think of adrenals as the cheerleaders of the endocrine system. And the reason why is because they're affecting your thyroid, they're affecting your estrogen and progesterone balance. So there's a dynamic interplay between the cortisol, which is you can think of it your fight and flight response hormone that your adrenals are releasing. Now, cortisol is coming from the same place in your cholesterol pathway as progesterone and estrogen. So if you are chronically stressed and you're chronically driving that cortisol up, what we tend to see is that you create an estrogen dominant situation for a couple of reasons. One, estrogen, from where estrogen is pulling out of that steroid pathway. But two, we know that when you're under stress, you drive up the same enzyme that produces cortisol, produces DHEA. You convert DHEA to estrogen. So no matter what's going on with the gut, that's kind of like a different box. If you're stressed, then your adrenals are going to be constantly producing an estrogen dominant situation. Majority of melasma I've seen has been estrogen dominant, but I have actually seen some progesterone dominant cases as well. And that's where it just goes back to that balance, like I briefly talked about before. So this is where it becomes really important to get a control of our stress and kind of redefine a new relationship with our adrenaline, which I know can be hard because I love adrenaline. Who doesn't? It's fun. But that cortisol is also going to be going full circle around and affecting your thyroid. So we need the right normal level of cortisol for optimal thyroid production and thyroid hormone metabolism. But if it's too high or too low, then we're going to have thyroid issues. If we have thyroid issues, what are we predisposing ourselves to? More melasma. So you can see how you can't just focus on the estrogen progesterone. You have to focus on the gut, the adrenals, the thyroid. You have to focus on the whole endocrine system if you want to truly treat melasma from the inside. So this is where it's a whole juggling between all of those different areas. Some of the easiest thing to do with adrenals is, one, make sure you are having a really set circadian cycle. You're going to bed as consistently as you can. You're waking up as consistently as you can. I've loved the ginsengs, the herbs for supporting adrenal function. The rhodiola, eleuthero, ashwagandha, they all have a different profile. And if there's interest, I can totally kind of give a Thrive Live on the different ginsengs and the different qualities of each and why we choose one versus the other. But there's beautiful adrenal herbs out there. In teas, you can get holy basil, which is a really nice, kind of more calming adrenal response. It's also a blood sugar stabilizing response. And just talking about diet for a second, if your blood sugar is going up and down like a roller coaster, that is going to activate more of your cortisol, your stress response out of the adrenals. And that is going to be a physiological stress on the body. So then remember, if you're stressed, you're going to be driving more of the estrogen dominance. So that is where there's a lot to the diet, and we'll get a little bit more into diet as well, that you can do to just balance the adrenal pathway and balance out your hormones. Let's talk about detox. So we are bombarded on a daily basis by external toxins. We got plastics, the air quality, gasoline particles, pesticides, you name it, it's integrated into our daily life, and we just have to come to terms with that. So we do want to focus on our ability to detox these out on a pretty consistent basis, because this is just the life that we're living in now. So our primary detox organs, and I did a whole Thrive Live lecture on detox, and it's so much fun. But the primary detox organs, kind of the keys we want to focus on, is liver, kidneys, gut, and then you can get deeper into the lymphatics and deeper in from there. But you usually want to start on the basics. So if you're not staying hydrated and not flushing enough of the toxins through your kidneys, or if you're not having regular, nice formed bowel movements, if you're liver is a little bit dysfunctional and maybe you're getting more gas, bloating, digestive heaviness. Those are some of the signs sometimes. Then oftentimes a lot of your detox pathways are not optimized. Now, you could be symptom-free in those areas and still needing detoxification support. So sweating is an awesome way to go about doing this. Infrared saunas, even just bumping up your liver support, kidney support will be effective for those. Green tea is one of my favorites, 1 cup a day, hands down. It actually improves estrogen metabolism out of the body, so helpful for melasma with your estrogen dominant cases. It's anti-inflammatory, it's helpful for the liver, it's helpful for the pancreas. It's gonna also really open up your detoxification. And then yogi teas, traditional medicinals, they make a lot of really good kidney-specific detox, liver-specific detox. There's so many different blends of detoxes out there. So to some extent, I like all patients to basically be doing a detox 1 to 2 times a year, just because of the environment they live in. And then also take a moment to reflect on, well, what are you getting exposed to? You know, especially like the plastics are going to be a xenoestrogen. So they're going to act as an estrogen in the body. So are you drinking your water out of a glass, or are you drinking it out of a plastic? And you know what we've seen with breast cancers before, now that a lot of bottles went to BPA free, is now we're just catching other plastics, other toxins in the breast tissue. So it's amazing how much plastic is usually in our life. And just go through your kitchen, try and get rid of as much as plastic as possible. Don't reheat food in plastics. Try and minimize the food that's stored in plastics. Try and switch to glass for as your water as you can, and just try and start to minimize what you put on your skin, because that can be its own makeup, lotions, shampoos, conditioners can be its own route of toxicity that you're adding directly to your skin, because your skin is actually porous. So looking at like the Think Dirty app, ewg.org, they give you a ton of information on good products, bad products, toxic products, clean products. Water and glass. So let's talk about genetics. So we can't change your genetics, but we can change we can affect how your genetics are turning over. So this is the whole idea of epigenetics. So there's a lot of talk about the methylation pathways, the whole MTHFR pathway. The reason why there's a lot of talk in that area is that the MTHFR pathway is what turns over your DNA, which every single cell, if it's regenerating, is going through this pathway. This is your anti-aging pathway, if you want to think about it that way. And so what improves this is all your minerals, your B vitamins, your glutathione, your antioxidants. But genetics is more than just taking those nutrients, because the soup that your genes are sitting in, the soup that your body is sitting in, is going to be affected by your detoxification, your gut health, your inflammatory load, your adrenal load. So it's just starting to even take a step back and to focus on improving gut health, improving detoxification, improving your diet is going to actually improve the soup that the genes are sitting in. So if you have a better soup, then your genes start turning over better because there's more nutrient rich. You have the keys that you need to turn over that DNA pathway. So not everyone can handle the methylated Bs because the MTHFR gene or the rest of the pathway. But talking a little bit more to that pathway, so you have MTHFRs are actually kind of higher up. You have your methylated B12s and folates, turn them over. And then you have to clear that biochemical process through your COMT genes and the MAOs. And the COMT also detoxifies estrogen. So if you improve your methylation pathway, you will also improve your estrogen detoxification pathways as well. So that is going to be hitting more of your minerals across the board, your magnesium, your glutathione, your B12, and your folate. And a really good multi will have all of that. And if you can't handle the B12 or folate, triggers anxiety, insomnia, then there's actually a couple that don't have that B12 and folate in it. You kind of have to make it, but you can actually do it. And that also goes to just the quality of food that you're eating. You want to be eating a nutrient-rich diet that actually is providing the minerals and providing all these nutrients for your genetic pathways. Because if we improve all these genetic pathways, then you move estrogen better through it, then you detoxify better. So that in itself could be its own lecture. If you have questions, just jot them down. I'll get to them at the end. So the thing that I have been seeing more and more recently is I'm seeing a lot of mold, mycotoxin connection, overall fungal load with my melasma cases. And I'm seeing that we'll clear the gut, we'll clear the adrenals, we'll clear the thyroid, we'll kind of work through all those points. And then we'll finally go in and treat a presumptive fungal load. Sometimes we'll actually spend the money to test because it can be a pricey test. That is when we start to see the melasma clearing. Now, we're all exposed to fungus on a daily basis through the foods that we're eating, or maybe we're eating a fruit or a veggie that has maybe gone bad and we didn't really realize that, or we've been exposed to a mold or water, to a moldy building, water damaged building. And if your gut function flora is off, then that's going to allow your fungal burden to go up, right? Because it's going to allow that yeast or that mold to actually colonize. So this is purely clinical. I actually haven't done any research to see if other docs have seen a connection with the mold, but I can tell you that I'm seeing it in a lot of my melasma cases, this secret, undiagnosed mold connection. And to me, that just kind of makes sense because I think we've all been exposed and we're all getting sicker guts, and that allows mold to colonize when you have that sick gut. So let's talk about treatments because I want to make sure I have time for this. So topically, you've probably all heard, avoid the sun, because we know how the UV radiation is damaging and driving for that melanin production. In terms of sunscreens, EWG, environmentalworkinggroup.org, has a great write-up on various sunscreens. So does the Think Dirty app in terms of what's toxic, what's not toxic. Lightening agents. So I've done these before. Usually my approach is we can do something topically just to help to mitigate and give a little bit of relief while we work on the inside. Because if you just do topical, then of course melasma is going to come back because you didn't stop the internal process. With bleaching agents, you just got to be careful of the skin type. If you're a darker skin person, then we don't want to over bleach your skin. So hydroquinone is a super, super common skin bleaching agent. There is also non-hydroquinone skin lighteners such as azelaic acid, kojic acid, and niacinamide. So azelaic acid inhibits the tyrosine in the skin cells and has an anti-proliferative effect, so stops all the proliferation, and cytotoxic, so it is killing to those cells. Kojic acid is actually derived from mold, so a lot of medication and cancer meds are actually derived from mold. This one is derived specifically from aspergillus and penicillin, and it inhibits the tyrosinase by chelating the copper at the enzyme site. And niacinamide. So niacinamide is the active form of B3. So we think of it as the flushing. Niacin is the flushing, niacinamide is the non-flushing. So niacinamide blocks the transfer of the melanosomes from the melanocyte to the keratinocyte. So basically, it's stopping that melanin movement. It also has an anti-inflammatory effect and increases the biosynthesis of ceramides, which is basically increasing those lipids in the area and strengthening the permeability of the skin. So I've definitely done a blend of all these topically for patients as a cream, and then we've added in a little bit of hydroquinone if we needed to increase the skin lightening agent. Glutathione, I've used that as well. It does have a skin whitening effect because similar pathway, it inhibits that tyrosinase, And it's also a natural antioxidant. It's the biggest antioxidant in our body. We can't eat it, we have to produce it. So as an antioxidant, it's going to reduce that inflammation. I think I've even added vitamin D into these creams before. I have done some crazy concoctions, and the best that I have seen is the vampire facial, hands down. It's my favorite. So they're basically taking out your platelets, spin them out, activate it with calcium, paint it on your face, and then run a little microdermabrasion needle over it to get the platelets into the skin. So because it's your platelets are the healing component of the blood. And so it activates healing in the skin, it restores collagen, it restructures the skin, and it helps to get into those deeper layers of the skin. I have, with my melasma patients, I have seen that you need about 3 or 4 treatments to get through those layers of the skin. And then from there, it's maybe once a month treatment, once every 6 month treatment. Dr. Adam in our office does them. I've just seen in terms of topical treatments, that is by far the most effective in comparison to the lightening creams or the chemical peels or the lasers and light therapy. And I think a big reason why is because it's actually using your platelets to heal the skin, heal the collagen, restructure the skin. It's using your own body's innate healing power just by painting on your face. So chemical peels, let's talk about that. Most of my melasma patients start off on chemical peels. So these are agents that are removing the skin layer. So with each chemical peel, you're going deeper and deeper. So start superficial and then usually work into the medium and then your deeper layers. And so as you traumatize the skin like this, then it triggers epidermal regeneration. So that can help, all of these can help get rid of the old melasma while we're working on the inside to stop new melasma growth. I have had cases where we were able to just got that melasma to resolve, to line up and go away without doing the topical. Everyone is different. Sometimes it's the topicals, generally speaking, just help to give you some relief in the meantime, and it can start to speed up at least healing topically of what's there while we work on the deeper side. So lasers and light therapy, the big risk here is hyperpigmentation after you've done the treatment. So you've done the treatment and then all of a sudden you get like a rebound increase in pigmentation. So these are really not good for darker skin toned people. It's usually using an intense pulsed light and just delivering this broad spectrum of light of 500 to 1200. And it's not one that I usually recommend because the vampire facials are so effective, and the risk of having that rebound hypertension, I just don't think is the opposite of what you want. So let's go into diet. So in terms of the diet, you want your food to be supplying your antioxidants. So you want to focus on eating all the colors in the rainbow. You want to really be hitting high on your plant fibers, 70% of the diet. Going organic can play a huge role here because of how you have that detoxification affecting your estrogens in the body. So going organic is going to cut out the pesticides and just get rid of anything in the diet that is driving the melasma forward. You want to try and minimize your animal meat. So just make sure you balance your protein. You're getting enough protein. Getting plenty of good fats. I think one of the worst things we did in the 80s was the low-fat diet, because when you remember, we need that fat to heal the skin. So avocados, olive oil, coconut oils, seeds, those are all great. Nuts can be a little bit inflammatory. So generally speaking, it's kind of good to cut out the nuts until at least you figure out if your body is reactive to nuts. Cooking your veggies over eating them raw is key. It can be really key for a couple of reasons. One, if you have low stomach acid, then if you eat raw veggies, that takes a lot more digestive load. And so that as you have your digestive load increases with your food, and if you're not digesting it, then that can increase gas, bloating, digestive inflammation, kind of creates bigger issues down the tube. But also cooking your veggies increases the binding capability of those veggies. So it's going to bind up more mold, more fungal toxins. Your veggies now, cooked veggies now become a way to detoxify your gut from environmental toxins and mold toxins and fungal toxins, which is pretty cool. Generally speaking, none of my patients really, well, I would say none. 80% of my patients don't eat enough veggies. So have veggies for breakfast, veggies in every meal. Veggies need to be there and eating the rainbow. Cutting out the coffee. And the reasoning why is going back to that whole stress adrenal response. A lot of my patients are, and myself included, we just tend to run hotter in the adrenals. You know, we're more stressed in our COVID era lifestyle, but even pre-COVID, the demands of work and family and life were high, and we tend to run higher in that stress adrenal dominance. The caffeine from the coffee is really potent at driving that cortisol response, which will increase our estrogen production. So that's where we want to really look at trying to mitigate the caffeine load and replace it with green tea. Yes, green tea has caffeine. It's like really small compared to coffee, and you get all of those positive medical benefits from it. In terms of specific antioxidants, some of my go-tos are going to be more the glutathione, pycnogenol, astaxanthin. I find that they help 10%, right? Because they are just bumping up those antioxidants, but like the topical treatments, at least bumps that up. So then gives us time to go in and fix the gut, adrenals, thyroid, et cetera, et cetera. So that is basically why melasma is so complex. So go ahead, and if you have any questions, type them into the box. Love to answer any questions that you guys have about it. Question is, what kind of probiotics do you recommend? I am really high in soil-based probiotics at the moment. Megaspore Biotic is the main company that I'm using because they can keep their probiotics in spores. And the spores are the ones that improve the overall biodiversity of the gut. And we know that more diverse gut and more diverse bacteria count in the gut is a healthy gut. So we see stress restrict the biodiversity in the gut. We will see poor food choices. Standard American diet will restrict that biodiversity, and we want that biodiversity to help mitigate that estrogen. Now, any other non-soil-based probiotic is going to be like your lactobacilli, your Saccharomyces, your bifidobacterium. So those all have a time and place too. They just don't colonize the gut. The spores colonize. So I find from more of a long-term gut health perspective, the spores are doing that because they're colonizing. They're going to be pushing things out of the gut that aren't supposed to be there. So I really like those a lot. And if you can't handle the soil-based probiotics, then just start with the non-colonizing one. You know, Super 8, I know Whole Foods sells that, is a good one. I've actually really liked Jarrow's probiotics as well. I've seen really good clinical results with the Jarrow for patients who can't quite handle the soil-based ones, because if you kick off too much stuff at once with the soil-based, your gas bloating just skyrockets. So, but those soil-based ones will do the long-term benefits, I should say. Question is, I've heard that melasma feeds on sugar. Yes, sugar is one of the biggest drivers of inflammation. Melasma is a chronic inflammatory skin issue. So, and so not only does it drive inflammation, sugar will also drive yeast, will drive mold. And remember, that's one of the secrets to melasma. And it will drive a dysbiosis in the gut. So it kind of also goes back full circle to the gut, where the gut is the first foundation to start. And so it's fascinating to me and to everyone, once you go through and you realize how much sugar is in our diet. It's the #1 food additive for selling food, cereals, packaged goods. You will always see pretty much always sugar in the other ingredients list. And it's amazing how much sugar is in our diet because it's what sells food, what makes people want to go back and eat that food again. Question is, would that include fruit? Probably kind of depends more on the glycemic index. So the lower glycemic index fruit, the better. I don't think you necessarily have to still avoid the high glycemic fruit. You just want to be conscious about your glycemic index with the fruit. So your berries are going to be on the lower glycemic versus more like bananas going to have a higher glycemic. And so the fruit, if you're eating a ton of fruit, then I could see, and a ton of high glycemic fruit, then I could see that driving it kind of more in that traditional sugar pathway. But stick with the berries. Those are going to be your antioxidant source too. Question is, you mentioned omegas, fish oils, etc. Is it worth taking the fish oil supplements or anything like that, even if you eat avocado seeds? Yes. I find that is highly beneficial because most everyone is kind of has a higher level of inflammation from either the gut or the stress or the adrenal strain. And with your fish oil, you usually want to make sure that it's stabilized with an antioxidant. So Integrative Therapeutics, I love their fish oil because they stabilize it with green tea. Otherwise, the fish oil can go rancid in the capsule. You don't want to be taking rancid fish oil. So definitely look at the quality of the fish oil that you're taking. I think even for kids, it's good anti-inflammatory for the brain. So there's a lot more benefits than just the skin, but if you start taking one, you will notice that your skin doesn't get as dry, your hair doesn't get as dry. So things that need those fats to heal and regenerate, you will notice that you do better. Good questions, keep them coming. The one cool thing I've noticed with, I started my melasma patients with taking astaxanthin, which is the concentrated omega from salmon. And we're noticing now that they don't get as triggered when they go out into the sun, which is pretty awesome because usually all my melasma patients are avoiding the sun like the plague because it just triggers their melasma. And now they're actually able to go out and handle the sunshine, which is pretty cool. It's not lightening the melasma, but it's actually improving their ability to handle it. And what we're noticing out for patients, because I'm now out in Colorado, is that living at this high altitude, that fair skinned patients, and myself included, that we are not, their skin isn't burning as it used to. With adding in the astaxanthin. So it's an antioxidant for the skin and helping that UV damage. Other questions? All right, oh, one more. Question is, I also read about taking zinc, MSM, milk thistle. What are my thoughts? Those are all great because the zinc is going to, the skin needs that zinc to heal. Milk thistle is going to help promote that liver detoxification. So any of those liver detoxification herbs, milk thistle, dandelion, nettles, burdock, somebody's doing a blend of all those. MSM, I generally tend to find that we're sulfur deficient because our food is sulfur deficient, because our soils are sulfur deficient. Our skin will need that soil to help heal as well. So our skin's going to need collagen, sulfur, zinc, vitamin C. Those are the big fours for healing the skin. And we usually give those post-surgery to help heal the cartilage after getting cut up. And so those are going to help more of kind of heal the skin, set down new skin tissue, set down new collagen. So usually you'll probably find up that it might help up to a certain level. And once you fill up those potholes, then you might not notice the effects and the improvements anymore after taking them. But getting those nutrients up can help, and then promoting your liver kidney detox. Question is, do you recommend to reduce coffee or eliminate it? And if we reduce, to what amount is okay? Great question. I would recommend to see if you can eliminate it for about a 2-week period just to give your adrenals a break. Now, if you can't do that, then just start to cut it down, start to reduce the amount that you're taking, and replace it with the green tea. And you can double bag the green tea if you need more of that caffeine to help wean off that process. And also the other issue with coffee is that it's one of the moldiest foods, hands down, that we eat or that we consume. You don't eat it, you drink it, that you consume. And so there are certain coffee companies that are certified mycotoxin free, and Purity is the one that I use, and I love Purity coffee. I think it tastes great. And then so that's a way that you can reduce your fungal load, is make sure you're not drinking moldy coffee. And then you can trial coffee back, a couple of weeks later and just see how you feel. Do you need it for energy? Do you need it for the brain fog? Because coffee is keeping us in this stress adrenaline pathway. And so it's good to take breaks on it, especially if you feel like you're dependent on it all the time. Now, coffee does have an antioxidant profile, but I generally find the green tea is better because it's actually better at eliminating those estrogens than the coffee. So it's kind of a roundabout answer to your question in terms of what amount is okay. It depends on the person. Some people can handle coffee and other people can't. It depends on how much sleep you're getting, state of your adrenals. I know my adrenals are shot because I have a 4-year-old who hasn't slept through the night in his life. So the other thing is having coffee on an empty stomach in the morning is probably one of the worst things you can do, because then you get immediate adrenals activating effects from the caffeine. And it's like getting rocket fueled your coffee into your blood system, and it creates a heightened cortisol response, heightened stress response in the body, versus you have coffee after, just put it after breakfast, will have a huge improvement in that adrenal stress response, which will feed back and help you produce less estrogen. But we have seen that cutting out coffee will improve your estrogen symptoms, so breast tenderness, lumpy breast, PMS. It will help to kind of start regulating that menstrual cycle because of the connection of how the cortisol and the adrenals and your estrogen progesterone balance. So a very roundabout way to answer your question. All right, any other questions before I have to go in a couple minutes? And if you guys think of any questions afterwards, just feel free to shoot over an email to the info.co@nawellness.com. I find melasma is really fun to treat because it's like opening up Pandora's box, where we got to go deep dive into all these different areas in the body and figure out what areas we need to address. And that not only helps your melasma, but oh my gosh, look at all the preventative medicine that we're doing. Look at how we're preventing thyroid disease, adrenal disease, and we're improving cardiovascular disease for 20 years down the road because we're improving all of your gut health and we're stopping chronic inflammation. I mean, it's mind-boggling how much chronic inflammation drives osteoporosis, cardiovascular disease, strokes, hypertension, all of these end-stage diseases that we see. And if we can stop the cycle of chronic inflammation now, then you're gonna be so much healthier when you're older. So that's why it gets so exciting. So, well, awesome. It was such a pleasure to see all of you. Thank you so much for rescheduling to today. I really appreciate your patience. It was a really good trip with my parents. Dad is just declining, unfortunately, but that's how Alzheimer's disease goes. So thank you for scheduling. I'm really excited about next week's talk. We'll be sending stuff out about that again. And if any of you are interested in joining up for our weekly meetups, I'm excited. I'll have a guest speaker on about once a month. And then if there's any topic you want to make sure we hit, just email it over and I will make sure that we get into it. So it's fun. All right. Everyone have a wonderful rest of the week. And thank you again so much for rescheduling to today. Bye.